Hi everyone, I'm Amma and I study medicine at Oxford, and today I'm going to be teaching you how to think like an Oxbridge medic. I'm going to be answering an interview question using the real technique, and the question that I'll be answering today is, what did you learn from work experience? This is how I would answer that question. To help me gain a more realistic understanding of what a medical career entails, I sought out a 1 week placement on an obstetrics ward in my local hospital. I really enjoyed my time there. I met lots of patients, doctors, and other healthcare professionals who really helped me understand the day-to-day life of a medical professional and also how a doctor's conduct will impact on a patient's experience. And upon reflecting on this time, I think one of the most important things I took away from my work experience is the importance of good communication skills. Before I did this work experience, I think I kind of recognized that a doctor needs to be able to convey information to patients in an understandable manner so that they can have full autonomy over their health. However, from doing this work experience, I realized that communication is actually a lot more complex than this. For instance, communication isn't only verbal, it's also non-verbal. So for example, one of the patients we met wasn't fluent in English and an interpreter wasn't available. So this meant that the doctor had to adapt the way they presented information to effectively engage with the patient. So for example, they had to use more hand gestures and visual aids to supplement kind of simple short sentences to help reinforce that information. The doctor also used body language to establish a level of trust with the patient, such as maintaining eye contact and nodding as the patient spoke. I think that this really helps strengthen the patient-doctor relationship despite the language barrier, which is really important, as lots of patients find healthcare settings really daunting. So positive interactions with doctors can really help break down those perceived barriers, and that will ultimately lead to a better patient experience. The experience made me think a lot more laterally about the ways communication needs to be adapted in different medical scenarios. So for example, a doctor will treat people from all walks of life. So for instance, a doctor needs to be able to ensure that the treatment they offer is culturally sensitive for a patient, or they need to be able to communicate effectively with a patient with cognitive impairment. So there's lots of situations with a patient where a doctor needs to ensure that the communication skills are kind of adapted as needed. And furthermore, I also saw that doctors don't only work and see patients, they work within a multidisciplinary team, and they also spend a lot of time teaching other doctors and medical students. So this means that they also need to be able to adapt to their communication in those situations to ensure that they're able to get their point across effectively depending on whatever situation they're in. So that's what I found quite interesting in my work experience, and that's what I learned. So that is how you think like an Oxford student. Thank you for listening, and I hope this was helpful.